sonography. Being able to perform abdominal sonography will make all the difference. So, our next patient is scanned in the echo lab, as I heard from you. I'm very curious.
This was a male patient, 72 years old, with hypertension and a systolic murmur, and he came for blend echocardiography. He had no symptoms, no clinical symptoms, and felt quite well. So what do you think, Christian?
I think the left ventricular function is quite okay.
Yes, he had...
Isn't it?
Yes, it's okay. And he had a mild aortic stenosis, which explained his systolic murmur, and he had left ventricular hypertrophy.
But there was something special about
So that's not very exciting. But now, when I performed a subcostal view, I found something strange. So what do you see?
Okay.
The left liver lobe at the top of our picture, and there's something in that should not be there.
Yes, you're right. I think it's a bad surprise.
Yes.
It looks like there are hypoechoic lesions in the liver.
Yes.
One is greater than the other over here. And when we find hypoechoic lesions in the liver, this could mean malignancy. There are some few cases when the lesion is benignant, but most likely this will be a malignant tumor, maybe primary or secondary.
That is what we thought too. And so we scanned the rest of the liver, and sadly we found other lesions, like we see here.
Okay. Now, you used an abdominal scan?
Yes, and use an abdominal probe then.
Okay.
It's not so easy to detect, but we can see some hypoechoic lesions again. Maybe you can stop the picture. And here, also at this picture, so highly suspicious for malignancy. And of course, we thought, where would a primary tumor be if this would be metastasis?
So you went on performing?
Went on performing.
Ultrasound scan of the whole abdomen.
So
okay.
What do you think of this picture, Christian?
So what we see here is the pancreas, this hyperechoic organ over here. And at the end, in the tail of the pancreas, we see a hypoechoic lesion, which is quite great.
Yes, it was a big one, easily seen.
And every hypoechoic lesion in the pancreas is suspicious for a malignancy. So further diagnostics has to be done.
Yes, we did a CT. And our diagnosis was confirmed. The patient had a carcinoma of the pancreas and multiple liver metastases and intrapulmonary round lesions, and also suspected osseous metastasis. So the patient was treated at the oncologic department. And this is a quite sad case because this patient came without any clinical symptom, just for a routine echocardiography, and went out of our ward with a diagnosis of advanced cancer.
So the key point is the ultrasound beam does not stop at the diaphragm. When you see something in the neighborhood, go on with scanning, continue to make an ultrasound. In this case, abdominal ultrasound. It wasn't so easy to see, but when you are going for our course and you learn how the liver would look like, you will see that this was not a normal liver.
The next case is one of a pregnant woman who came to our ward in a life-threatening condition.
It was early in the morning when I get a call from the obstetrics department that abdominal sound is needed because the pregnant woman has intensive pain. So for my clinical routine, I expected a gallstone or a stone in the kidney. So I started with the scan of the right upper quadrant.
The gallbladder seems normal to me.
No gallstones?
No gallstones,
exactly.
But there is something nearby in the vicinity of the gallbladder, which disturbs me.
There was this glance of free fluid over here, only some drops maybe of free fluid. So I continued the scan and scanned the lower abdomen.
Oh, and there seems to be a lot of free fluid in here. We can see the intestine, that are these hyperechoic structures over here, and in between we can see the black fluid, which means there's free fluid in the abdomen. And this shouldn't be there.
I stop the image and will show you these dark areas show no echo. So there is free fluid, and free fluid in the abdomen can be ascites or, in this case, blood. So it was a really life-threatening situation. So I went on, and in the case of bleeding in a pregnant woman, we have to think of
the baby?
Of the baby, extrauterine gravity. So I was looking for the uterus, and there was a normal pregnancy in the normal uterus. And so I was very confused about it.
If you look closely, we can also see the little heart beating over here.
The blood
Luckily,
tests,
yes.
the blood tests were normal. There was no decrease in hematocrit.
But anyway, she had a lot of abdominal pain, with a quite sudden onset, and free fluid in her abdomen. So, what did you do then?
There was a strict indication for operation, so the patient went to the operation room. And what was found was a twin pregnancy, one baby in the uterus and another pregnancy in the fallopian tube, which ruptured and caused a severe bleeding, which would harm mother and babies. So the fallopian tube had to be resected. And the interesting is that all lab tests did not show the severe hemorrhage at this time.
And what happened to the baby after the operation?
Luckily, the baby survived, and mother gave birth 28 weeks later to a healthy baby. So the baby and the mother could be saved.
That's a nice case.
By ultrasound. In our next case, we are concerned with a female patient, a teacher who had undergone hysterectomy the day before, and there were no complications during the operation. But in the following time,
I was on call the next night, and the patient was in increasing abdominal pain since about an hour, and my colleague from the obstetric ward called me to help her. She had already performed an ultrasound scan of the lower abdomen because the patient localized most of the pain over here. And she thought maybe there would be blood in the bladder and asked me for a second look.
So that's the first scan you made from the lower abdomen.
Yes.
And I think over here we can see the bladder.
Yes, you're right. It's empty, so it's not so easy to detect. Why is it empty? Because post-operative, the patient has got a urinary catheter.
But the structure we are concerned is this over here. Hypoechoic and hyperechoic, and
quite big.
Quite big. Maybe that's an hematoma, correct. But not in the bladder. It's near the bladder, I think.
Right. I thought so too. I could not detect blood in the bladder, but this hematoma over here. So I was a little bit concerned that maybe the bladder had a leak because there was a little bit of blood in the urine. And so we filled the bladder retrograde through the catheter with saline solution. Okay, and luckily,
I can see it here.
We detected no leak.
Mm-hmm. The bladder was filled. And just seen over here. Okay, no leak. So only one hematoma?
Yes, but of course, I did a complete scan of the abdomen and I saw something else.
Ooh, over there. We can see the liver here and the kidney over here. And now when we take a close look, in between these organs we see these areas without echo, echo-free areas, which means free fluid in the abdomen. So a patient after operation with free fluid in the abdomen.
What could it be?
Blood. I think that's blood.
So we took a blood sample 2 of the patient and she already had dropped with her hematocrit. So this was an acute indication for an operation. The patient went to surgery and some major bleeding of some vessels was found, and could be solved.
Do you have any pictures of this?
Yes. Luckily, my colleague took some pictures of the surgery site, and here we can clearly see that there's a lot of blood around the liver over here. It was really life-threatening and was a good case for me because we could solve this problem immediately. And for us, the key message is,
if you see free fluid after an operation, this is likely blood. And so surgery has to be done.